On today's episode, transforming the work of the Canadian Institute for Health Information with its new CEO, Anderson Chuck.
I love Canada. That's why these issues are important to me. That's why the health system is important to me. That's why the sustainability of the health system is important to me. And the health outcomes for Canadians is important to me.
He's a health economist focused on using data to help power improvements to our healthcare systems. And in this podcast, you'll hear how Dr. Chuck's mission is to get CIHI's data out to health leaders faster than ever and with greater context around what those numbers actually mean.
I don't know whether people realize that we are sitting on probably the richest data set in the world, that if we were to work together, how incredible Canada could be as a leader in research and innovation and development.
Welcome to the Canadian Health Information Podcast. I'm Avis Favreau, the host, and this conversation is with CIHI's new president and CEO about moving forward in a time of great upheaval, what changes to expect under his tenure, and how they will ultimately help improve the healthcare of all Canadians. Hey, Andy, welcome to the podcast.
Thank you so much. Privileged to be here.
You've taken the helm at CIHI at a really remarkable time. So much going on in the world. We've just come through a federal election. The United States continues to harass us with tariffs and talks about 51st state, AI, healthcare, wait times, staffing shortages, and here you are at CIHI, which I've seen as this sort of island of calm, usually because it's data. How does it feel to be stepping into this role at this time?
It's actually really exciting. And the reason why I say that is because of the things that you describe. I think there is a unique opportunity for us as a country to act, to do something. Whereas in the absence of these circumstances, there may not be the same kind of motivation for us to come together as a country to act. And so for that reason, it's pretty exciting.
Because have we been a little complacent about how important data is in healthcare? I know that we realize it as a country that it's important because we have CIHI, but could we have been more on the ball in terms of the importance?
I would say yes, but not in the way where I think it's complacency. I think it's just the fact that the challenge of the health systems today across the country, like they're firefighting every day. They have emergency wait times. They have wait times for other services, access, workforce shortages. There are significant and serious issues that health system providers across the country are dealing with. And so what's happening is that while you're fighting the fires, you're not thinking about the other things that we need to do from a medium to longer term point of view to actually get us out of these kinds of situations from the broader strategic sense. What a better time to step into the environment that people are willing to act.
So I detect a shift here, a push forward.
Absolutely, yeah. Like a shift in the mindset. You know, if we're talking about the situation right now that's creating the conversation around sovereignty, it's not just sovereignty around trade or sovereignty around like the economics and economies, it's also sovereignty in data information itself. Canada has a pretty significant opportunity. I don't know whether people realize that we are sitting on probably the richest data set in the world, that if we were to work together around using that information for the benefit of the country, how incredible Canada could be as a leader in research and innovation and development, at the end of the day, benefits patients, families, and Canadians.
So your background is a health economist. Born and bred in Alberta, and you've moved your family to Ontario.
Not born, but definitely bred in Alberta.
Okay, where were you born?
I was actually born in the Philippines, and my family immigrated here. I was about 2.5.
My experience has been that people who end up in healthcare of some sort usually have some sort of a personal experience that drew them into this field. So what lured you into healthcare and then health economics?
Honestly, I've always been drawn to healthcare. I think mostly at a young age exposed from my dad. My dad back in the Philippines was a physician, and coming to Canada, he then worked for the medical examiner's office back in Edmonton. And so through that linkage, I've always been exposed and thought about healthcare. But the switch to health economics actually occurred later during my university days when I got a chance to work at an Alzheimer's care facility. And I got to see the actual delivery side of health services from a business point of view, from a policy point of view. And I thought to myself, oh, this is pretty cool. What's going on in here? And so that area of sort of like the planning and the business and the delivery really intrigued me. And then the angle with economics is just really the reality that, you know, at the end of the day, it's about patients and families, but also that resources are not infinite. And so there's constraint. And how do we utilize resources in a way to optimize the best outcomes for patients and families? And so I guess those three things all together put me towards a path and a career towards health economics. I felt that I might be able to affect more change and more impact at more of that, maybe the policy level, at the service delivery organizational level.
Because you could have done some of that being a physician. At what point, Andy, did you realize the power of data?
Oh, from a really young age, not even just around health data, but just counting and observing. Math was something that I've always was, I think, particularly sort of drawn to, science as well. And I think that in something like healthcare and healthcare delivery, the truth matters because the stakes are really that high when it comes to patients and the care that they receive. And it's in some cases, many cases, it's literally life and death. And you really want to be able to talk about facts and evidence in that context.
So when did CIHI and the data that CIHI collects come into your orbit?
Yeah, well, I mean, that can be traced back again, early university days onto the master's days, right? Utilizing CIHI information, because when you're trying to figure out what's going on in terms of health systems, where's the place in the country where you can get comparable information across provinces, across Canada? And CIHI was the one-stop shop that had that richness of information. And for me as a health economist, it's really important to know not just the money side of things, it's also to understand what are we achieving for the resources. At the end of the day, it's about value. And so CIHI was a place where you could get the data that talked about and showed value.
One of the first things that you've done since arriving at CIHI was actually go through the membership there with the health researchers, the clinicians, the patients, and various provinces and territories. And so what are they telling you about what CIHI's been doing right for the past 30 years?
The experience that I've had using with CIHI data, I heard back as well in terms of the researchers or policy folks or clinicians or providers, like whomever I spoke to talked about the utility, the usefulness of having data. That goes without question. But if I were to say, well, what's one thing, the one thing that CIHI really was able to establish in terms of their minds was the trusted part, a trusted place for a source of truth when it came to health information. That was something that I heard loud and clear, and that trust is really, really, really important. But I also heard the things where they felt that CIHI had an opportunity to really improve.
Like what?
They're really thirsty for is information. So they're drowning in data, thirsty for information. And what is the kinds of informational things that they're really seeking? And it's really around storytelling. It's not enough to just have a data point out there. It's connecting the dots and helping connect the dots across the data points to tell a story to then better understand what's really going on. Because until you understand from a system view about what's really going on, well, can you ever even think about designing the changes that are needed to improve the system? You can't take things in isolation. You can't take things out of context. Can CIHI help be a storyteller of what's happening?
Did they say they wanted data faster to be able to make decisions faster?
For sure, like faster, cheaper, more efficient, even in terms of the production size of information. Because this is the thing about CIHI. CIHI is an organization that's founded on partnership. And so this is not CIHI data. This is the data of Canadians that are given and shared with CIHI through the provinces and territories. And so from that point of view, it's this partnership we have. And so can there be a way that the production and the delivery of the information to CIHI, can that itself be less burdensome?
When you look at other countries, where does Canada compare in terms of its ability to process and spit out the data that needs to be used somewhere?
It's an interesting situation Canada's in. So as I mentioned, like we're probably sitting on what is the most valuable data set. That would be the envy of the world. But because the data at the moment is siloed, we don't fare as well compared to other places where the data is more freely shared and utilized, not just for patient care, but for other secondary uses as well, such as research, development, innovation, developing new therapies, treatments, stuff like that.
So what's your goal there?
Our goal is to have high quality information that is actually connected and shareable. I think that would be a significant step forward for the country to break down the silos of that data flow, to then enable the kind of health system design, service delivery models that would truly impact the health systems towards better patient outcomes and experience for patients and families.
Can you explain what that would mean? Like, what would that mean doing?
So let's talk about it like just from a patient point of view. What would that actually mean for a patient? So imagine a world where you're a patient and you see your family practitioner, then you go to hospital, or then you go get a prescription from your pharmacist, and then that data is all connected. It follows you. Imagine that you don't have to repeat it again. From the clinician point of view, imagine they see that information. It's all connected. They don't got to go chase it. They don't got to go find it. The story of whomever the patient is all right there. And that continuity of information, we know, leads to better health outcomes. It's almost like a no-brainer. But the reality is, though, is that unfortunately, data does not flow that way currently.
I know primarily the data is really from Canadian hospitals. Are there other gaps, like, for example, family medicine, private clinics, that you would like to access to get a fuller picture?
1,000%. So I had talked about the necessity and the need around having that system view. Well, the system view isn't around just tertiary care. It's not just about hospitals. It is around the whole continuum from primary care all the way, in fact, to long-term care, right? And everything in between. And so there's definitely data gaps in the comprehensiveness of information and the connectedness of that information across those sectors of the health system. And that is definitely an area that we need to progress on for sure.
So let me follow that question. Are you getting data from family clinics and private clinics? And if not, how do you go about adding that to the pack of information so that you can get a really good, complete picture?
We are getting pieces of information, but they're not comprehensive or systematic in any kind of way. And part of the solution to that isn't so much CIHI's role, connecting the information from primary care with the other parts of the system. And so we need to do that so that we can actually access and get good primary care information.
You see that happening? You can envision that?
We don't have the luxury of not doing it. If we're really serious about improving the health systems and improving the experience and health outcomes for patients and families, this is not a nice to have. We have to do it.
What are the key points that you're going to try to hit?
Connecting the information is a major thing, right? Stewardship and governance is another major thing.
What does that mean?
One of the realities we have in a wonderful country like Canada is the fact that we're federated. To get the provinces together towards a common agenda and work towards these common things that ails across the country. Another one, modernizing hospital systems, right? Which means basically, as I talked about, getting data faster, not waiting for information, almost getting closer to real-time hospital data feeds is another area.
What would it mean to patients, to health providers, to the researchers, and even to governments who are trying to manage very complex budgets and aging populations?
So it would just mean, again, for patients and families, right? Having information that's connected, that's there available across their entire patient journey. And as I mentioned earlier about physicians, having the story around whomever that patient is that's connected across, again, the patient journey. It also means for researchers and innovators access to information that helps them develop and figure out solutions to health system problems and innovations that are needed for future therapies and treatments. For policymakers and ministries of health and health authorities that we have across the country, it means having better system views, connecting the dots across data points to provide that system level understanding of what's going on so that they can actually then develop what the levers of change would be.
Switching subjects a little bit, one of the other blessings of this chaotic time that we're in is an immense amount of misinformation, disinformation. We are now seeing measles outbreaks because people aren't getting vaccinated because they're concerned about that. Do you see CIHI with its role of data being some kind of voice of reason in the middle of all of this?
I do. I mean, I think it's really important that there be trusted institutions, that the information is taken seriously, credibly. There's value to that information. Ensuring that the information that we produce and share is of high quality, and CIHI does those things. But it's also what we talked about in terms of faster information. Because the reality for folks is that if we don't provide information at the time they need it, they're just going to go somewhere else to get it. And if CIHI doesn't have it, then that's a missed opportunity, actually. And the quality of information, the timing and timeliness of that information, connecting that information, all of the above lends itself to relevancy and therefore trust. Like, it's a one-stop shop for trusted information about your health system that you can depend on, rely on, and use.
I really like the concept of timeliness because you're absolutely right. If it isn't there when people are looking for it, it doesn't have the same sort of impact. So that's a good one. Amongst the parts of the transformation with CIHI was what I noticed, an acknowledgement of Indigenous health. We know that Canada in recent years has come through a very powerful reckoning of the role of governments and different agencies in harming people of Indigenous backgrounds. How does CIHI plan on transforming the way Indigenous data is used, and why is that a priority for you now?
This is a topic that's actually pretty close to my heart, just because we've known for a long time that the health outcomes for these communities are poorer. And they're poorer because of systematic things that are happening within the system, right? Either whether it be access or other reasons. And so it's from that lens, it's that inequity has been something that has bothered me. Okay, so that's why it's important, at least to me personally. And you think, oh, okay, we need to address that and come up with all these solutions and interventions and implement. But, in listening to these communities, they've said, wait, hold on. Before we start solutioning, can you tell me if I even feel safe within the health system? And so when we talk to these communities, one of the first things they said around the kind of CIHI or the indicators and the data that they were interested in wasn't around clinical interventions. It was simply CIHI's approach is to develop that trust is, okay, we hear you. And so the indicators that we've been working on with these communities has been around cultural safety, because they told us that's what's important. And that part around they told us what they felt they wanted, self-determination. That, I think, is the key to develop that trust so that we can finally work together towards improving the health for those communities, because it's us supporting them do what they believe actually is what's important to them. Not coming there with some kind of paternalistic, we know best. No, we don't know best. Let's listen to these communities about what's important to them and then work with them to develop the data.
As the son of immigrants who came to Canada, does that experience change the way that you see these subjects? Does that affect you in terms of how you assess healthcare on an economics level?
I really, really owe everything to my parents. I owe everything to this country as immigrants and parents that come to this country to have a better life for their family. So I love Canada. That's why these issues are important to me. That's why the health system is important to me. That's why the sustainability of the health system is important to me. And the health outcomes for Canadians is important to me. And hence why the things that CIHI is working towards with partners is important, because we need to do these things in order to have the sustainable, high quality delivery of health services for the best patient outcomes possible.
So we're gonna throw in the artificial intelligence.
Okay, yeah, it's a big one.
This is a very hot topic. Will CIHI use AI to help with its data collection? And if you do that, how do you protect the safety of the data?
Wow, it's almost like we would need another podcast, honestly, to talk about this particular topic. But here's the thing about AI. It definitely has for the better, the disruptive capability. It has that potential promise.
Of help collect the data and assess it.
It's like all of the above. It's not just about the data, the collection of information, the analysis of that information, like the applications and the use cases for AI. It's so broad that truly it's actually limited by your imagination. But conversely, that's why it's so important to focus and have intentionality with AI. So the promise of it can do everything, that's actually the risk. It can do everything. We need to be more intentional with where AI can have benefit. And there's also the real importance around to have AI that's relevant for Canada. What do I mean by that? I mean that AI needs to be trained on good data, good Canadian data. So sovereign models of AI is really important. And again, we have the richest data set to train AI for the benefit of Canadians. So CIHI definitely is thinking about this and thinking about how can we support the development of sovereign models of AI for, again, the benefit of the country and the benefit of Canadians, because we really do have an opportunity when it comes to AI in Canada that I think is uniquely beneficial for us and better than what would be produced anywhere else in the world.
It sounds like you're sitting, I know you said you mentioned it before, but it does sound like you're sitting on a gold mine of health data that could help Canadians and help people around the world.
Yeah, but I really want to make a point to distinguish that it's not CIHI sitting on it. Canadians, we are sitting on it. And it's siloed right now, and we're this untapped resources that we're not able to leverage. We're sitting on, and when I say the benefits of it, I think I want to be specific. Why is this data set so valuable? We have one of the most diverse populations in the world. What's the benefit of that? The benefit of that is that you produce richer AI models because of the diversity. The diversity is actually an asset. Because of the way that health systems are delivered and funded, all patients are in the data set. So we have population data that's inclusive and diverse. At the same time, in terms of infrastructure and support, we have the best, I'm going to say it, we have the best researchers globally. We also have institutions like CIHI that have experience in the stewardship, governance of being able to house, collect, share information. We have all these assets, but yet we cannot bring it all together in terms of the leveraging and liberating the information for all of this benefit. And this is what I mean, like Canadians were actually sitting on this.
I guess my last question is, so you're just starting, where would you like to be in 5 years from now?
I've thought about that sort of the vision when people talk to me, Andy, what's the vision for CIHI? And the way that I like to characterize it is sort of more broader than CIHI. CIHI's purpose is for the benefit of Canadians. And so the way I like to characterize it is imagine what 5 years from now would look like for a patient, for a researcher. So for me, I've talked about this before, but imagine a Canada where a patient has their information that follows them across their entire journey, across the system. Imagine a Canada where a clinician or a provider has all that information at their fingertips. They don't got to chase it. It's all right there, and they can provide the best care for whomever the patient is because they have the information. They know the story of that human that's in front of them. And imagine a Canada where researchers and innovators, they have access to information under appropriate safeguards and security and privacy that allows the generation of innovative therapies, products, treatments for the benefit of Canadians. Imagine, and this is why it's so important, because think about your loved ones. Wouldn't you want your loved ones to have first access to certain treatments that could save their life? Like anyone who's had a sick kid, anyone who's had a grandma or a mom or someone who has a terminal illness, wouldn't you want the opportunity to be available to be enrolled in a trial? Like these are the kinds of stakes that are happening. And as I said, imagine a country in the future where system policymakers and those in health system delivery, they have the full picture of data across the system that allows them to really understand the levers for change and then to implement the levers of change. And CIHI has a significant role to play in working across partners and with jurisdictions to deliver, I believe, on that future.
It's a big job.
No, it's a big job.
It's a big job. Yeah.
But important enough that we all collectively do this.
I'm glad you have the youth and the energy.
I don't know sometimes, but as I say, I owe this country a lot.
Thank you so much for talking with us, Andy. I really appreciate it.
No, it's my pleasure. Thank you so very much.
We hope you enjoyed listening to Anderson Chuck, the new CEO of CIHI, and you can read more about the transformation he referred to with the plans posted on the website at CIHI.ca. And that's where you'll find more information on the Canadian health system, everything from surgical waits to data on ER visits, and much more. Thank you so much for joining us, and subscribe to the podcast on your favorite player. I'm Avis Favreau. Talk to you next time.